This is a very important question that we are going to answer today. Is under eye filler better or under eye fat transfer better? Now, both have their place in improving the aesthetics of the under eye. Now, under eye, also called as the tear trough deformity, many women and men come in their mid 30s or mid 40s asking for improvement and a rejuvenated look in the under eyes. So, most commonly, the first thing that we offer is a filler injection. Now, why do we offer this filler injection and why is that our first choice? Why it is our first choice is because it is a reasonably less invasive technique. It is done as an outpatient procedure and it takes hardly 10 minutes and you're back home, hardly a little bit of bruising, maybe sometimes very rarely, but otherwise you have a very easy recovery and within a week your full final result will be visible. The chances of complications are very less and the recovery time is really fast. It is almost like you have not had anything. It's like a lunch break procedure, having a filler into your under eyes. Whereas when we actually inject fat, your recovery time is prolonged. We take some fat out of the tummy and process it, make it into something called as a microfat, and then we inject it into your under eyes. And this is not as subtle a procedure as a filler. This requires a little bit of dissection, some local anesthesia to be given, and a kind of a prolonged recovery. You can definitely expect some bruising under the eyes immediately after a fat transfer procedure. Now, then why do we even offer fat transfer? Because fillers are temporary. Every 9 months or 1 year, you will have to come back and get the filler injections done. Whereas fat transfer is reasonably long lasting. I wouldn't say permanent because aging reverses everything, but the fat will stay there for a long time. You don't have to come and get multiple injections done. Sometimes you could come for a touch-up just as a second procedure, but after that it will remain reasonably stable for a period of at least 10 to 15 years. So that's why fat grafting is also a very valid option. When you look at the finances as well, I mean, one injection of filler and one injection of fat transfer also is pretty much very similar in costing, but filler will go away in 1 year whereas fat will stay back. So there are many ups and downs for both procedures. So we'll discuss this with you and then you can make a final decision as to what you actually want.